Before we get started, I just wanted to know if Mayor Dinatelli wanted to open up the procedures.
Thank you, everyone. Thanks for your attendance tonight. This is a little disappointing is probably putting it mildly. I'm not sure what was supposed to happen tonight. I think this was, in all deference to the powers that be, put together pretty haphazardly. So I'm hoping the message gets back that we need to do more of these. We need to do them more effectively. We need to communicate them certainly better than we did with this event here and some of the events in the area itself. I know that there's going to be a similar presentation tomorrow in Leominster. There was, what was it, Athol yesterday? Athol. So what I'm also told is that this is going to be discussing all services, not just birthing. Again, that was a misunderstanding on my part. I thought this was the result of the closing of the birthing center and how we can hear your concerns and what you would like to see so that those services continue. And I'm afraid what's going to happen from this is at some point, and please, God, that there's going to be a loss of life because of some of the deficiencies that we're trying to deal with now. And I hope that I'm proven wrong. But again, I want to thank Department of Public Health for coming out tonight and providing us with information. But we need more than this. This is not sufficient. So once again, thank you.
Thank you, Mayor. I'm Kiami Mahania. I'm the Undersecretary for Health for the state of Massachusetts. And the goal today is for DPH to really hear the concerns that you have around, and it's really stemming from the closure of the Leominster Labor and Delivery Suite. But we are interested in terms of, if you wish to talk about mostly maternity, that's also fine with us. Part of it is really to figure out from you what are the barriers that not only you're experiencing right now, but sort of the history of the closing of services and the lessening of services in the region, and what are the barriers that are most significant for you and your community in terms of accessing care. It could be obstetric care, but it can also be other types of care. And also, currently, what do you feel are the most critical services that you have in your community that you wish to keep, but also critical services that you feel are not present in your community? The mayor is correct that this was a rapid-fire event. The governor wanted it everything to be wrapped up by November 15th. And so we have two separate ongoing efforts. One, and that's what tomorrow's event in Leominster is, which is a statewide maternity services discussion. Now, DPH started that process about 2 years ago, so that's an ongoing process, and that's the end of that process will be in the next few weeks. And then there's a separate North County listening session where where Athol and Fitchburg, that's where that falls. I'm very sure that once the report is delivered to the governor, that it would only reinforce her desire to focus on the North County area. And I'm very sure that there will be more outreach events, there'll be more also announcement events in the weeks and months to come. And I'll let Jen Burrell introduce herself.
Thank you. Hi, everybody. Jen Burrell. I'm the Deputy Commissioner at the Department of Public Health, and we thank you all for being here tonight. I do have the list of individuals who have signed up. There's some of you who have stated that you'll possibly come up and speak. I will call your name, and you can decide then. We're asking that you do come up to the microphone so that everybody can hear you, including some of the staff who are here taking notes as well tonight. With that, we're going to start with Fawn. You don't want to? Great. Next, I have Scott. When you come up, if you could just state your name and where you're representing, that would be great as well.
Sure. Good evening, everybody, and thank you for coming out to talk about healthcare services here in North Central. My name is Scott Carrigan. I'm the Vice President of Healthcare Programs for Making Opportunity Count, headquartered here in Fitchburg. I came on board with MOC in November of 2019, tasked with adding healthcare services to the catalog of things that we offer to the community members here in Fitchburg and in Leominster, Gardner, and all the surrounding towns. One of the things that had come out of a community health assessment was that behavioral health was in great need here. So we had starts and stops in determining whether we were going to do that. When the pandemic hit, it sort of really cemented things for us. We knew we were going to have a real healthcare crisis, particularly related to mental health services in the area. It's become sort of a healthcare desert here in Fitchburg. So we embarked upon opening an outpatient mental health clinic. That process took us nearly 2 years. We went through plan review, went through licensing and suitability. Everything sort of takes months to sort of process through, and layer the pandemic on top of that, and it really took extra time to get it open. We opened things up in June of 2021 is when we eventually got our license. It took about another year to get an MBHP contract to be able to deliver those services. Those are the services that sort of take care of people on mass health and the ACOs. So that was really a problem for us. We actually were providing the care but not getting reimbursement. But we sort of moved along in that process. We've endeavored to hire more and more therapists. We have wait lists both for adults and children. Our children's list is even longer than the adults. One of the things that we sort of have stumbled upon here is that we think a lot of folks probably retired during the pandemic, and we've had a real hard time, finding the therapists out there. People sort of stayed where they were for a little while. The market opened a little bit. But we're competing against Worcester, we're competing against Boston, we're competing against telehealth pretty much across the country at this point in time, because people are doing it from their homes. So the last few months we've done a little bit better in hiring people, trying to bring people on board, but reimbursement for the services, whether it be through Mass Health, whether it be through commercial contracts, just is not keeping pace with what the expectations are of the people out there looking for jobs. We have brought their salaries up significantly, had a 10% raise across the board last January to try to be competitive out there. It has helped. But when you look at where you're really getting for the services that we're providing and what we're putting out, there is very little left to reinvest in our programs, which worries us for the future, quite honestly. Sort of speed things up to today, so we actually are working on opening a family planning clinic here in Fitchburg as well, receiving funding through the department for that. We've been working on that for about 1.5 years now. We actually received our license to operate the clinic back in September 6th. But we really couldn't apply for Mass Health to be a provider there until we had that clinic license, which we have done. It's been more than a month. I haven't heard anything yet from Mass Health, and I've called a few times. So there are a lot of barriers sort of in the administrative process of opening these clinics, even though we want to provide these services. I've taken nurse practitioners from other companies. We brought them in. We're keeping them busy building policies and things like that. But they're able to deliver care, yet I can't deliver care because I can't sort of move through the process and get reimbursed for it. So that's a challenge for us as well. Looking at the landscape here in Fitchburg, we know that a lot of primary care physicians, if you came here 20 years ago and you drove around, there were lots of offices. Those that live in the area would tell you that. Most of those offices are gone today. people picked up and left. We're seeing a huge gap there. We're hearing it when people call for mental health services, probably hear the same when we're actually operating our family planning clinic. So we're going to endeavor to get into primary care here as well and bring primary care back to Fitchburg, particularly around that Cleghorn neighborhood. Lots of folks don't have the transportation. We did work with MART, the local busing service. They are actually coming to our location now because we're co-located with a lot of the executive offices of the state. So that does help, but we're looking for ways to sort of do that cost effectively, and that's going to be a huge challenge for us over the next couple of years as we try to get that program off the ground. So those are all the things I really wanted to share with you this evening. Again, thanks for coming, and we hope that we can be a partner in making things better here in Fitchburg.
Thank you.
Thank you, Scott. Next up, I have Mary. And I'm sorry, I can't read the last name, but I think it begins with an L.
L-O-T-Z.
L-O-T-Z. Thank you.
Good evening. Thank you for having this meeting tonight. My name is Mary Lotz, L-O-T-Z-E. I'm from Fitchburg, and I'm also the community co-chair of Health Alliance's Patient and Family Advisory Council. I'm not here to speak about the birthing center. I've already had my say on that, and that's probably a fait accompli. I accept that. What I'd like to talk tonight about is I didn't realize Scott, who's sitting at the table with me, had some of the same concerns, and that's the lack of substance abuse, mental health care in the community. And I'll just sort of lump it all under substance abuse and mental health care. But this is both acute and chronic conditions. We just do not have the capacity in this area to take care of the need of these patients in our community. It has a detrimental effect on the emergency department at Health Alliance and probably Clinton Hospital also, because what you end up getting is a backup of patients that cannot go through the system. So because they can't, the patients who come in with so many of these mental health and substance abuse problems, they can't be, there's no beds, there's no capacity in other facilities for them. They end up boarding at Health Alliance and in the emergency room. That backs up patients waiting to get in for acute care into the emergency department. That affects and negatively impacts the entire community because people then don't want to go for adequate care because they say, I'm only going to end up waiting for 4, 8, 12 hours anyway. So it just has a detrimental cascading effect going backwards. We need substance abuse providers. We need mental health providers, again, acute and chronic. We need inpatient facilities. We need community facilities, community resources. And these things need to be on a sort of a continuum basis, because what we have is fragmented care even when we have it. So we need a well-coordinated an allotment and an assortment of care throughout the community for all of these kinds of care. One of the reasons, probably you know more than I do, but I'll say it, one of the reasons is poor reimbursement for patients with these types of conditions. So we have poor reimbursement, we have lack of providers, we have lack of specialty care, we have fragmented care with poor follow-up through the continuum of the patient. One of the things I told somebody that I was coming here tonight, so this is not why I came to speak. This is something that I just picked up on my way in when I told somebody I was coming tonight. They said, could you mention the concerns that the community has with the migrants coming in and the communicable diseases that they possibly are bringing? I don't know if any of this is true, fact or fiction. There's fear in the community, and I think the fear has to be accepted and bona fide, or at least evaluated. I had the statistic that this individual gave me, something like 40 school children have been now placed in the Westminster school system. These are concerning to parents. These are concerning to the people in the community. I'm putting that out because this is a problem. Thank you.
Thank you, Mary. Next, we would like to call up Representative Kushmarek. I'm really hoping I pronounced that correctly.
You did, but I'm happy to let anybody else in the audience go first.
Feel free to come on up. And while you're on your way up, oh,
Thank you guys for being here. I'm James Hale. I am a disabled veteran, and I live in the community. One of the things that I'd like to address is poor support for the disabled veterans. I don't know for how long, but I know it's been over 30 years that I have fought with the VA system over getting rightfully compensated for the disabilities that I endured while serving my country. And there's nothing that I would change, but the support that we get when we come back seems to have been the biggest dilemma. I received a bad conduct while in a legal country over a piece of THC. Now, I argue that 99.99% of the rest of the time I served honorably while I was on duty. This was an off-duty offense. I did 9 months battalion extra duty, received a bad conduct discharge, spent 6 months in a military prison camp, all over a piece of THC. Now I've been out. My son Adam is here, of 6 children that I helped raise. I'm still responsible, I'm still respectful, and I've always asked that other people treat me the same. Now, I've written many politicians over this issue. I have fought laws, including marijuana laws, in the state of Massachusetts because of this issue. I take it for anxiety for medical reasons now because of the way that I was treated and lied to and tormented. And now I decided that I would show up and be a voice for those who don't have one in the community. Disabled veterans deserve better. I know I deserve better. I know I don't deserve to be characterized as a bad conduct person when I'm far from it. I know I'm an honorable person. I don't need to be labeled or profiled by government, making me to be a bad conduct character. It's a difficult label to live up to. It boxes me in, doesn't give me any room for growth. What I've tried to find out is why can't I get the support that people say that they give when I've written to many of them. They don't even respond. I set up meetings, I meet with interns, not even them. This is a problem when we talk about behavioral health, when we put labels on people. And what I don't want to see is fellow veterans being treated the same way, knowing if it's happened to me, it can happen to the next veteran. And I wish better for my fellow veterans. Thank you for having me.
thank you. Representative. And while the representative is up, would also like to acknowledge Representative Kilcoyne, who's here as well.
Thank you. First, I want to thank the Department of Public Health for being here this evening. Well, I know the mayor discussed it earlier. In the future, I'd love the opportunity for more advance notice so we can ensure that we have wider community participation. But I appreciate the administration's willingness to come to our communities, Athol, Fitchburg, and Leominster, and throughout north central Massachusetts, to discuss, in particular, the essential service closure process, as well as the impact on maternal health care to our region. I won't relitigate what we've already discussed, I think, in detail over the last 3, 4, 5 months. In an effort to save the maternity unit at Leominster. But certainly I feel the North Central delegation and our community was very clear in expressing our fears and our concerns about the lack of availability to maternal health care should the Leominster, and inevitably when the Leominster unit closed. And I think today those fears not only have been realized, but the fears still remain, particularly given the most recent news about the bankruptcy filing of Haywood Hospital. As part of the essential service process, we were often given, the reassurance that the close proximity to Haywood Hospital and their maternity unit and labor and delivery would provide adequate insurance and backup for our community and give us options if inability to get to Worcester was the factor that Haywood was just a 15 or 20-minute ride away. And today, I think those fears are very quickly resurfacing just in the past few weeks based on the most recent announcement and fears that, once again, we could be faced with losing the only access in North Worcester County to prenatal and birthing care in North Central Massachusetts. And so as we reflect back on not just this essential service closure, but previous ones, my challenge to you, my plea to you is that, if faced with this again in North Central Massachusetts, is to exercise really the only power that you can at times is through the executive branch and denying service closures in the future where it would deprive and put disordinate impact on communities of color, socioeconomically challenged communities, rural communities, and urban communities alike. And you asked earlier about maybe some of the back history of essential service closures, and I think why you heard so loud and clear and so definitively in one voice from our community, whether it be from Clinton, from Gardner, from Leominster, or Fitchburg, is that the past 20 years are full of history of essential service closures and almost are the bookmarks to each chapter of our regional history, bookmarked by closures. And Fitchburg used to have a hospital half a mile up the road from here. Burbank Hospital was once a full-service hospital. Leominster had a hospital. Clinton had a full-service hospital. Haywood, as well as Neshoba Medical Center. In this region, and in fact, at one point, Fitchburg had 2 hospitals. And so 20 years ago or less, when the decision was made to consolidate Leominster Hospital and Fitchburg into Leominster, it was made with those promises and assurances of this will expand access to healthcare and expand quality access to healthcare in our region. And that consolidation doesn't always mean that your region loses something. And I think 15 years ago and 20 years ago, we were willing to play ball and work with those assumptions that at times consolidation could result in better care and treatment. And instead, what we've seen each of these communities that I've mentioned, substantial service closures at each location. Fitchburg's entire hospital closed, including urgent care. Well, I'm thankful for a first-class cancer center right up the hill. It doesn't replace the services that we lost. Neshoba Medical Center, vast majority of their services, they're no longer a hospital, they're a medical center, and a number of their services have closed. Haywood's services have often faced consolidation and closure, and most recently Clinton and Leominster Hospital. And so we're often left with this fear of, will the only access to healthcare and treatment 20 years from now be to drive to Worcester or to Boston? And while we're assured, whether it be from the healthcare providers or the Department of Public Health, that won't be true, what we've seen is a series and decades worth of decisions that have resulted in that becoming closer to reality than myth. And so while the legislative delegation stands pretty resolute, just 3 months ago, we stood together at a joint committee on healthcare finance before the legislature in full support of providing the Department of Public Health with more teeth and more resources to enforce essential service determinations. My challenge to you would be that when we have thousands of community members come out and pour their heart and their soul out and express their deepest fears about how they'll provide health care to their loved ones, be it the unborn child or their elder on their last days of life, that we utilize every option available within the executive branch to be able to prevent such closures. And with that, well, I realize that we have a hearing today and you'll have another in Leominster coming up. My hope would be that we continue this conversation, that I hope you know that you have an entire delegation in North Worcester County of legislators who stand ready and willing to assist you, to provide you the resources and the political backing to be able to empower you to make those decisions in the future. And with that, I want to thank you once again, and I want to thank all of our community members who came out tonight, those who have already spoken. Thank you for your service, sir, and for all of you who will bear your heart and soul this evening. Thank you.
Thank you, Representative. Next on the list, I have David Roth. Great.
I thank you for being here also as a longtime member of the community. Fitchburg has been through a lot. I won't repeat everything that Mike said, but both of my kids were born at Burbank Hospital. We were promised when that closed, well, the emergency room will stay open, and then, well, the urgent care will stay open, and then it was, well, Leominster has everything. So again, I have that kind of concern. I come here not as a professional in healthcare, but I am on the Human Rights Commission in Fitchburg, and I think that healthcare is a human right, and access to healthcare. Long waits in the emergency room in Leominster, since there isn't one in Fitchburg, hurts that, as does the closing of various departments, and transportation issues, never mind the issues of maternity and prenatal. In addition, I'm on the board of LUC, which is based right here in Fitchburg, and we work with a lot of people with mental health issues, with substance issues, with homelessness issues, and of course, healthcare issues. So some of what was already said by Scott and others, whether it's reimbursement issues, being able to get a general practitioner or a specialist for mental health or substance issues, is a big issue in North Central Mass also. We work with DPH, we respect what you do. There's more that's needed, especially in our area here. Also, I happen to be the president of Warmer Winters, which is a local nonprofit, 100% volunteer nonprofit, whose mission is to help neighbors in need. And one thing we see in North Central Mass is the need is growing ridiculously fast since the pandemic. One quick example, one of the places that we distribute it to every year, Spanish American Center in Leominster, we usually had about 150 people show up for coats from the Sheriff of Worcester County and sweaters, scarves, mittens, and hats from us every year. Last year, 450 people showed up to our regular visit. That's 3 times the normal amount. And it's because there are so many people in need out there. So I think someone really has to listen. My mom and I used to volunteer at the Burbank Hospital Fair. You know, that was an important part of Fitchburg. We were given those promises. On the Human Rights Commission, our chair actually works at Haywood Hospital. A lot of fear going on there also. Healthcare is a human right. That's the main thing I want to make clear here. I love Fitchburg. My grown kids happen not to live in Fitchburg with their kids. If they were here, they'd be more concerned about maternity and child care in this area for health. I just think it's really important that we continue to work to help our neighbors. That's what makes a community successful. Fitchburg is coming back. I'm very proud of Fitchburg and people like Mike that are helping that come back, and our mayor and our people in this town. Being hit with a loss of more medical care hurts that rebirth of the city of Fitchburg that we all love. And that's pretty much what I wanted to say. Thank you.
Thank you. Next up, I have Chelsea Patras.
Hello, and thank you for coming and being here with us tonight. I'm Chelsea Patras. I'm the Executive Director of CHNA 9, which is the Health Equity Partnership for North Central Mass. We serve the 27 cities and towns of North Central Mass as the Public Health Coalition for the region. And I wanted to point out that one of the barriers, the primary barrier that our region faces is that Massachusetts has a very long history of a model for funding and policy that is both urban-centric and one-size-fits-all. And what I mean by that is we tend to develop programs and staffing and funding that are specifically related, directly tied to how many people are being served. And how many people you can serve in a densely populated urban area is much, much different than how many people you can serve in a 27-town, widely dispersed rural area. Not only is that headcount completely off and the reimbursement of that completely off, but the amount of organizational power that it takes to you're not working with one municipality, you're working with 27 individual municipalities in order to get some of these same results. So the barriers to getting some of these results is much higher. And there simply isn't a model. I think Massachusetts needs to develop a funding and policy model that fits rural communities. I don't think that's specific to North Central. I think it's descriptive of most of our rural communities. I will say that as part of our community health improvement process, we recently did a planning series with community members, and we interviewed over 160 community members in some intensive focus groups where we did priority planning, and what came out of that process was this very interesting striation of goals, and what came out at the very end result was what we called these conditions for well-being, and those were goals around mental and behavioral health, healthy food access, housing. All of those things were things that everybody needs, right, in order to live a healthy life. But they weren't things that you could directly impact. They were things that were impacted by all of these other things. And those other things were, the second layer of that striation was environments. And the two environments that people spend the most time in are some sort of education or childcare, and workforce. And so those environments need to be supportive of those conditions for health. And at the foundation was 4 specific goals, and one of them was transportation and access. And transportation came up even in our communities that don't have any transportation, that are very car dependent, where everyone essentially expects to have to drive. They all still universally said, if you can't get there, it doesn't matter what services there are. I think, looking around this room, there's some of that barrier shows up here, where, people maybe didn't have the ability to get here tonight. That doesn't mean that they didn't want to show up. The other 3 were being more intentional to dismantle racism in our systems, connections and collaborations between entities, between agencies, municipalities, organizations, and that is actually something that I think North Central Mass does an incredible job of, far outsizing. We're scrappy here. We talk to each other, we get things done, And I think our legislative delegation is a wonderful example of, speaking with one voice and making themselves heard when, individually they may not have a lot of power in our legislature, but they have definitely, as a combined force, made themselves heard. And I think that plays out with many of our initiatives and programs in the region that we keep going simply by our collaborations. And the fourth one was policies and funding. And I think I already spoke to, how that is, it's just not enough in our region. I think that we really need to look at what works, because there are things that are working really, really well. What breaks my heart is when we pilot something and we show how amazing it works and what impact it's having, and there's no funding to sustain it. Or getting denied funding because we don't have a good sustainability plan other than needing to continue fundraising to get more funding. That's not how a pilot is supposed to work. A pilot is supposed to be prove that this works so that you can be in a funding stream to continue doing it. So that's what I have to say.
Thank you very much. Anthony Zarella?
Thank you. I'm Anthony Zarella. I'm City Council President here in Fitchburg. Again, thank you for coming out. I would certainly like to see the city government and the community consulted proactively in the future rather than only after there's a major problem and outcry. But it's still good to have you here. I made some notes for myself because, as anyone here who does know me can tell you, I tend to ramble a little if I don't have things laid out. But first, I want to just second what the previous speaker just said about the regulation models. I'm an attorney, and I can tell you, anyone, it's not just healthcare policy either, anyone who reads law and regulation for the state of Massachusetts in almost any area, it's blindingly obvious that it's written and calibrated to the greater Boston area. But, at the risk of sounding flippant, Massachusetts doesn't end at 495. And most of those policies, especially in healthcare, but across the board, are simply not suited to anything outside of a metro area. This is a systemic issue, so I just wanted to make sure to highlight that it's not even just healthcare, even though I know that's your purview specifically. And I wrote down some of the questions that you asked at the very beginning, because I wanted to make sure to address them directly. You asked, what services do we have that we value and need to keep? The answer is simple: we can't lose any more. All the ones that we still have, we need to keep because they're already inadequate. And the same answer, what services do we not have that we need? Just look back over that 20-year history and look at all the ones that have been progressively stripped away. We need a labor and delivery center. We need inpatient pediatrics. We need emergency rooms. We need a cardiology unit. We need all those things that we used to have, but that were taken away and moved to Worcester, moved to Concord, moved to Boston. Again, all well and good for people who live in a metro area. We don't. And what barriers do we face? Well, yeah, people have touched on transportation. That's definitely a big one. But I think the bigger picture, because I think this is a problem with the entire process, and it's not your fault. You guys have to work with the statutes as they exist, not write them for yourselves. But the problem is we are a city of people, not a city of numbers, and the average resident does not exist. It's an abstraction on paper. There is no such thing as the average person actually living and working here in Fitchburg. So when we went through this whole process in the past months and several years ago when it was the closure of the pediatrics and the cardiology, we were repeatedly told things like, well, the average citizen in the service area would have no difficulty getting to Worcester or to Concord or to wherever else. Well, the average citizen doesn't need health care. Specific people who live here in Fitchburg need health care, and those specific people may have below average means in various ways. Some of them don't have cars and have to plan in advance to ask someone to bring them somewhere. That doesn't really work if you have a problem that you need to go and see a doctor for, or if your appointment gets moved or whatever. Some people have cars that can get them to and from work, but if you try to push them to highway speeds, they start making very alarming noises. For those people, real people, not average people, going to Worcester, going to Concord, even sometimes going to Haywood for care is not a viable option. I don't care what the numbers and the spreadsheets and the models say. The actual people can't get there. And that's the problem. The actual people need to be able to access health care in their community without waiting 4, 6, 8, 12 hours in the emergency room. And that's not optional. There is nothing that they or that the city of Fitchburg or any of the surrounding communities can do to make that any easier. The only solution is local access to care. And I'd also like to point out that there's a significant impact on emergency services here in Fitchburg, because if an ambulance, and this is not just for labor and delivery, this is also because we don't have inpatient pediatrics. Let's say you bring your kid to Leominster Hospital and it turns out they need to admit them overnight. That's transport to Worcester, to Boston, to wherever. Now, not only are ambulances expensive, someone of limited means living here in Fitchburg, if that ambulance ride isn't fully covered by their insurance, then they are in a financial crisis. But second of all, that ambulance has to go, let's say best case scenario, once Haywood is no longer a viable option, because it sounds like it may not be as much as we'd like it to be. Let's say best case scenario, it's Worcester that they need to go to. The ambulance has to go to Worcester with no traffic and no weather. That's at least a half hour. The ambulance has to stay in Worcester until the patient is fully checked in, fully handed off to their new physician. They can't just drop them with a nurse at the door and head back to Fitchburg. So that means that is an ambulance that is out of service in the city of Fitchburg for 2, 4, 8 hours, depending on the availability in Worcester of services at the emergency room. That means that's an ambulance that can't help if someone in Fitchburg faces an emergency. And if we have multiple such transports in one day, not only will we see serious complications for the people who have to be transported that far rather than getting care here in the community, but we'll also start to see serious health complications of residents here that are directly attributable to their inability to access emergency care in a timely fashion. to get a paramedic out to their house in a timely fashion. That's not acceptable. But the overall problem, though, is the process. Like Rep. Kushmerek said, you guys, and I said this at the formal hearing, and I said then and I'll say now, I do not mean it as an insult to you in any way. It's out of your hands. But you are toothless. I mean, imagine a law where you want to go purchase a firearm. So you go to the store, you have to fill out the form, get a background check. But if it comes back and says deny, all that happens is you have to fill out an additional form and then walk out with your gun. Wouldn't that be a pretty pointless law? And that's the situation with the essential services determination as far as I understand it right now. The hospital informed you guys that they wanted to do this closure. They went through the process. They gave their justifications. You declared it an essential service. And they basically said, thanks for telling us your thoughts. We're going to do it anyway. And that's pointless. I mean, I feel bad for you guys. You must feel a great sense of futility when you go through this process. I know I would. And it's not your fault. I really feel bad for the fact that you have to put all this time and effort in to make a determination that has no effect. So I fully support the efforts that our delegation is making. I would also like to see further strings attached to all of the benefits and subsidies that come along with the designation as a community healthcare provider. To me, that has to mean, if it means nothing else, that the needs of the community are considered on more than just a dollars and cents basis. And if they aren't, if an organization that has that status is not doing that, they shouldn't be getting $20 million of state money to subsidize their operations. They shouldn't be getting whatever other statutory and regulatory benefits they get from that designation. I apologize, I meant to look it all up, but ran out of time. There should be strings attached. If you're going to get those benefits, it should come with a duty of care to the community. It should come with a recognition that you cannot characterize a community by moving numbers around on a spreadsheet and saying, well, it's more efficient to focus on Worcester. It's more efficient to move our resources there instead of here. But where does that leave us? Our residents aren't in Worcester. Many of our residents can't get to Worcester. Improved service in Worcester does nothing for people living here in Fitchburg. I'm fortunate. You know, we talk a lot these days about privilege. I am privileged. I can get myself or my wife or my 3-year-old child to Worcester or Concord or even Boston in fairly short order if I have to. I have a good car. I have a job that allows me to make my own hours and leave anytime I need to with no notice. I have those things. But those are privileges that I have and that most people here in Fitchburg do not. So if the state of Massachusetts is serious about addressing issues of equity and fairness, whether they be racial or otherwise, economic or otherwise, and I think that the state is serious about that, but if they are, these things need to be addressed because, again, I keep coming back to it. We do not have a city or a north central region populated by abstract average citizens. And the people who are above that average, like me, don't make things any easier for the people who are below that average. We bring the average up, but that doesn't actually affect the people who are below that line. They're still just as poor. They still have just as many transportation issues. And so the numbers don't tell the story. So the two problems with the process, and the process is the big problem, are number one, you need teeth. I agree. You guys need teeth to be able to enforce your decisions. And number two, the process itself has to be less reliant on the numbers. I know there's a need for quantitative analysis of just about any policy issue, but it has to go beyond that. It has to involve someone, whether it's you guys, specifically you two, or someone else in your department, coming to the affected communities, not just to these sessions, but to walk around, to meet the local business owners, local residents, and to get a sense for what the community really is once you pull them off the screen and into real life. And only then can we actually fix this. Thank you very much.
Thank you.
Thank you.
We have one more individual signed up, and then we'll open it up if anybody hasn't signed up that would like to speak. But I have Marcy.
Hello, everyone. Can everyone hear me? Okay. So my name is Marcy Hainison. I am the Director of Resident and Community Services at the Fitchburg Housing Authority. So I'm here tonight to be a voice for a whole lot of people who you're not going to see standing on a sidewalk holding signs. You're not going to see them gathering in a big group to be a big loud voice so that everyone can hear their message. Our residents are the quiet people who have great needs, but those needs are going unheard. So I am going to give you some numbers. So according to the most recent census in Fitchburg, we have 41,502 residents. Of those, 13.6%, 5,644 people are over the age of 65. 12.5%, so another 5,187 people, are under the age of 65 and have a disability. Add to that 14.6%, or 6,000 of our residents live at the poverty level. These are my people. I have been on the Disability Commission for many years, and as the Resident Community Services Director at the Fitchburg Housing Authority, I work every day with people who fit in those categories. They are low income, and they are either over 65 or under 65 with a disability. And when we talk about essential healthcare needs, hospitals absolutely are essential, but there's an element of healthcare that if we want to be able to have people live safely, healthy, and age in place, we need to start acknowledging that home care is essential health care. We have so many residents in our buildings. We have multiple properties for elderly and disabled residents that I spend every day and I say, there's dementia. They're struggling with, they don't remember, I was helping someone look for their keys. And he was saying, does it look like this? Something like this? And I'm thinking, where is the social service support to make sure this gentleman is safe and can have the care he needs? We're not clinicians in the Housing Authority. We care about our residents tremendously. But what I have to do is make a referral. And I make a referral to an agency that will do its best, but some people would get case managers, some people might just get a little bit of help. But the reality is, I may go back and check their apartment because the neighbor says it smells so bad that they can smell it next door. So I go in and find out that, yes, they're getting home health care. Someone's coming in and doing their laundry and buying their groceries. But they're not seeing that this person, where's the dignity of being able to live safely in a clean environment? But if the resident who is struggling with early onset dementia or early symptoms of Alzheimer's doesn't articulate to their case manager, I need you to do this, this, and this. We have residents with hoarding disorders. Does anyone know of someone in this area who is a clinician addressing hoarding disorders? No, that's healthcare. Healthcare that is home care. We have other residents who they need someone to come in, they physically can't pull out their sofa or chair to vacuum underneath it, but their medication spilled and rolled underneath it. They need help. This is health care that is home care. Every one of these residents is on Medicaid. If they are not able to continue to live in a supported, to get the support they need to live in their homes, such as in the housing authority, they will have to go to nursing homes at the expense of the taxpayers. And average nursing home prices, even at the daily Medicaid rate, it's a lot of money. It's a lot. And why should they have to give up sleeping in their own bed at night, in their own home, just because they got frail and couldn't pull the sofa out to vacuum up and find their medication? We need to take care of our people. Our younger families over at Green Acres, our public housing family property, majority of them do not have cars. So they're calling the ambulance. All of our residents. I wish I could have someone here share how frequently emergency responders come to our properties. It's multiple times a day because our residents don't have access to the supports and the in-home health care that they need to be able to be safe, be healthy, live with dignity, and be able to age in place. We don't have anywhere else for them to go, though. So we need to make it a priority to provide this care for them, meet where they're at, where they live. And when I talk about those 12.5% under 65 with disabilities, many of our families in the Green Acres properties have children with disabilities. There are no ADA units there. That's not okay. To make the assumption that only the elderly need a grab bar or only a person in a wheelchair needs a roll-in shower. If all construction, when it came to all public construction, had mandated universal access in its building code, then our properties would be able to serve everyone, regardless of their disability, throughout their span of life. So I know tonight many of you are talking about the hospitals, but to me, essential health care, it's home. It starts at home. When we can keep people healthy at home, there's a whole lot of hospital care that won't have to happen as frequently. So, thank you for hearing me. Thank you.
Thank you, Marcy. I can vouch for all those emergency calls.
That is the end of the list of individuals who have signed up. If you haven't signed up but you would like to speak, now is an opportunity to do so.
Yes, please. I want to thank Marcy. I'm well familiar with what the work she does. And as a veteran who was left neglected and homeless at a hotel, abandoned, when a veteran organization decided to keep my SSVF emergency funding during COVID, I turned to people that I thought was going to help me and never helped me and left me there neglected, abandoned, and homeless. I had 6 children that I helped raise. My son is here with me, as I mentioned earlier. And it was over a divorce. I was getting divorced was in a bad relationship, decided I wanted out. I went to a veteran organization. I was familiar with the veteran organization, Veterans Incorporated, and I thought that they were there to help me. And I had a service dog. Speaking of disabilities and my disability, I have arthritis in my back, a hearing deficit, childhood glaucoma, PTSD, carpal tunnel tendonitis in both hands and arms, and stomach conditions with stomach erosion and ulcers from anxiety, and a heart condition from anxiety. And in the process of all this, from firsthand experiences, I've noticed that as I speak about veteran support and veterans not getting the support that they deserve, being in hotels, I got to meet some of the homeless in the areas. And even while I was left at a hotel with my funding removed because someone decided to keep the funding for emergency that goes to veterans by a veteran organization, which really still hasn't made any damn sense to me, but I've mentioned it to several state reps and never got any response. And I even went to the Commission Against Discrimination. And I was dealing with a funeral in Wisconsin with my grandma at the time of the hearing. The time zone difference of 1 hour, I called 45 minutes late thinking I was 15 minutes early. The case was dismissed, and everybody just walked away like it was nothing, like it never happened. And I was a veteran with my service dog with children that were adults. But at the same time, I'm thinking, well, how can I even explain this to my children? I'm supposed to be one of those that people are trying to look out for, and all that you see is these banners. We support our troops everywhere. And I'm going, where the hell's my support? And I ended up in Fitchburg Housing and had the pleasure of meeting Marcy. And, you know, in these areas of housing authorities, I very sadly see the crime rates going up, the suicide rates going up, homelessness rates going up. All the statistics veterans have happens in these low-income housing areas as well as in the veteran communities. And it always saddens me, like you never hear anybody talking about doing anything to reverse these actions. But as I've been on disability receiving SSDI because I had to work while disabled to provide for wives and children because I didn't get my VA compensation. But I wanted to make sure my kids and my wives were properly taken care of. I had to work. Arthritis in 3 vertebrae. I was once in a wheelchair on oxygen. My service dog and I, over a 13-year period before I had to put her to rest, you know, I was able to rehabilitate some of the medical conditions. Some of them just don't go away, like arthritis. It don't just disappear because you no longer have a service dog or on a medication. And that's why I chose safer alternatives than some of the medications. I was on 2 opiates and 6 psychiatric medications. That compensated for what I turned to marijuana 4 years later and advocated in behalf of because I felt it was more beneficial. And I'm now no longer in a wheelchair. I no longer have my service dog. I'm not on a back brace. I'm not on a cane. All that I do is sit there and try to find ways of helping people, including my neighbors, my children, and my friends, what very few that I have. But I take it very personally when I meet people and I see elderly couples whose husband passed away. She's in a wheelchair or paralyzed. They took him off in an ambulance, left her in the apartment by herself when she's had 2 strokes and paralyzed all on her left side. The following morning, I wheeled her downstairs to a director's office and said, how is this even possible? What is the contingency plan? There was none. And that totally dumbfounded me. And now she's in a nursing home in Leominster Life Care Center, been placed in a bed and been there ever since. 9 months. December 28th is when her husband died last year, and they were my only friends in housing at the time. You know, and I've seen this time and time again with our elderly and our disabled being treated like they don't exist. People don't recognize them. They don't want to shake their hand. They walk right by them in the street. And very easily, I found myself thinking about the guys who stand on the corners with signs going, no family, disabled, homeless, looking for help. And I thought many times I was going to be one of those people, and that's why I don't shun them. I give them my change when I have change. But I've seen many of them just get ignored as people walk by and pretend that these people don't even exist. And I'm one of those disabled veterans that sit there and say, people like me do exist, and they don't deserve to be shunned, as I have for over 30 years by this government that I thought was the greatest place on earth. I would give it my life, only to find out they didn't feel the same way about me. But this needs to change, and like Marcy said, this starts at home. I raised my children better, and I can't say the same for everybody else. Thank you.
Thank you. Is there anybody else? Okay. We thank you for your time. We will be here for a little bit. If anybody wants to speak to us and not sort of a group setting, we are happy to stay and continue the conversation. And as the Undersecretary said, I imagine this is not the only time that you will hear from us or see staff from the administration in your community. So thank you so much for coming out tonight. We really appreciate it.